Most physicians, and especially in some fields more than others, are incredibly compliant people. We get to medical school by doing what we're told and by doing the best at everything we possibly can and throwing ourselves into things. If you haven't thought
Yeah.
about abortion, if you haven't made a decision before that point that you will not participate in any way, you're going to get drawn in.
Welcome to Caring for Both, a curbside consult by the American Association of Pro-Life Obstetricians and Gynecologists, or APLOG. On this podcast, we bring on experts to provide insight to support medical professionals in their life-affirming practice and career. I'm Dr. Susan Bain, a board-certified obstetrician and gynecologist and a member of APLOG. I'm excited to be hosting today's episode. As a pro-life OBGYN, I'm passionate about advocating for my pregnant and preborn patients on social media, in my state legislature, and in everyday discussions with colleagues. During my career, I've had the honor of speaking with medical professionals who disagree with me on the issue of abortion. As a result, I recognize the importance of being able to make meaningful connections and have fruitful discussions with colleagues who disagree with me on this issue. Today's guest will be helping to equip you to connect with colleagues on the other side of this issue, which she's exceedingly qualified to do, given for a part of her career, she was on the other side of the abortion issue. I'm honored to be here with Dr. Catherine Wheeler. Dr. Wheeler is an obstetrician and gynecologist who practiced in Salt Lake City, Utah for 24 years before moving to Colorado. While in Utah, she was an originating shareholder of a private obstetrics and gynecology practice. Later in her career, she developed midlife women's health clinic and educational programs at the University of Utah. She then developed a gynecology clinic with HCA St. Mark's Hospital. Now, earlier in her career, Dr. Wheeler performed induced abortions, but has since stopped on moral grounds. Today, she's a frequent speaker for life and regarding the reality of abortion. She provides testimony at the Colorado legislature, provides informational opinion pieces and interviews for media, and serves with pro-life organizations to educate, to advance the defense of preborn human life, and to advocate for and provide support for women and families. So thank you, Dr. Wheeler, for joining us today.
Oh, thank you so much for the opportunity. I'm honored to be with you.
Well, part one of our discussion, and we're going to do two parts, but part one of this conversation will be about connecting with pro-choice colleagues on the topic of abortion. So to start, I want to just ask you, can you share a little bit more about your medical career as well as your journey to becoming a pro-life advocate?
I'd be happy to. I actually hadn't planned on becoming a doctor, but you know how these things happened. I wanted to be a veterinarian, changed to nutrition, started a PhD, and then ended up that wasn't the research thing, wasn't really, especially with the animals, wasn't good for me. So I ended up actually at that point exploring options, applying to med school, and shock of shocks, I got in. So I went to Tulane. Never expected to do OB-GYN. I find it really interesting going back. You know, I grew up in the 60s and 70s and really just had a heart for justice. My earliest memories were civil rights, the women's movement, women's rights. That's honestly my earliest memories. And really just had a heart for women. So it should have been not surprising to me, but kind of got into the feminist movement. And, you know, everybody thought women were going to be OB-GYNs or pediatricians. So there was no way I was going to do that. But I ended up getting married, having a surprise pregnancy in the middle of medical school, and had the right things happen. I had a friend, the first person I told said, "That's amazing. This is going to be awesome." Not, "You can't do this. Are you going to have an abortion?" And then my parents retired and actually moved to where I was in med school and took care of what I ended up with 2 kids during med school. So, my first rotation coming back in 3rd year, my son was born the 2nd day of clinical years, our first clinical year. My first rotation was OB-GYN. And there I was standing in the back of the room weeping over the beauty of this baby being born. And man, I was hooked. Like my whole life became the care of women. I love women. So yeah, I got really drawn into that. You know, I don't remember having any conversations about abortion, although I clearly picked it up from the culture as a right. And when I went to the
Mhm.
University of Utah was the first time for residency, that was the first time I remember any conversations about abortion. And of course, in that arena at the University of Utah, it was a major genetic center. And so we offered abortions for people who had what we called severe genetic syndromes and severe birth defects. So we're talking second trimester. And, you know, again, I don't remember any
Mhm.
ethical discussions. It was one of those things at the time, it was opt in. And especially in Utah, there weren't as many female physicians. We had a lovely female mentor, and I call her a soft feminist, very loving and caring. But, you know, this is a hard situation. If you care about women, this is one of those things that you do. And so I opted in. It was mostly the female residents who opted in. And so I learned how to do the second trimester abortions. That was my introduction.
Gotcha. So, just for our listeners, let me just explain when Dr. Wheeler says opt in, I was the same way. So, I trained in the 90s and we could learn to, during residency, perform induced abortions, but didn't have to. And that has since changed. Now it's opt out for medical students and residents where the expectation is that they must do that. And if you've been at all exposed to the hierarchy of medical education, there's that lowly medical student, the intern,
Mhm.
the resident, the attending, and the fellow. And to be told, go to OR room 25 and assist on that case, and you get to OR room 25 and you find out that, the baby's alive. And to have the courage and the maturity to be able to say, I'm not going to participate is really difficult. So when you were first being, introduced to this opt in, tell me a little bit about like what was going through your mind in terms of your comfort level with opting in and what kind of drew you to be able to do that.
Yeah, I appreciate you explaining all of that and the hierarchy. You know, it turns out that, and you know this, most physicians, and especially in some fields more than others, are incredibly compliant people. We get to medical school by doing what we're told and by doing the best at everything we possibly can and throwing ourselves into things. If you haven't thought
Yeah.
about abortion, if you haven't made a decision before that point that you will not participate in any way, you're going to get drawn in. And, you know, that I think, you know, I had picked up what the culture said. Somebody said that the most dangerous ideas are those that are not examined. You know, the culture said this is how we
Mm.
help women. Women need abortion to succeed. Women shouldn't have to, like, you have a choice whether you allow this baby to come to term. If it's a hard situation, maybe it's best to end it. You know, you have a choice, 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 rights, rights, rights. It gets so driven into our mind. You know, I heard Hayward
Mhm.
Robinson speak not long ago with CMDA, the Christian Medical and Dental Association, and he, like me, also did abortions and now is on the other side with 40 Days for Life. But he said, you know, you've got to decide in advance and draw your line. Don't even go in and look because it's a slippery slope. Once you go in, you kind of get drawn into the next step and the next step. And medical school is see one, do one. I mean, residency is see one, do one. So, you know, I think
Mhm.
having these conversations in an ethical way, we've dropped ethics out of medicine. You're expected to do it. It's hard. So we need to help and support, and APLOG does that so well, young people to really think about the baby, what the procedure is, which is taking the life of the baby, and help people to be strong and to draw their clear conscious objection right at the beginning so that we never even go in and see it. Once you've seen it, you're really kind of on a hard path.
Yeah, wow. That makes so much sense as you explain that, because I think what it does is it normalizes induced abortion
That's
for
right.
trainees, as part of what we often hear, comprehensive reproductive health care.
Right.
I think oftentimes students and residents have lectures, particularly now, but probably back when we were training too, that it's expected if you go into this field. So
Yeah.
talk to us a little bit about how did the shift come around where, most people who choose to do abortions, and it sounds like you were one of these people, like really feel like you're helping your female patients, your maternal patients. So talk to us a little bit about how did that shift happen for you?
Yeah, I would say it's a real twisted compassion. Um, you really care so deeply about the situation these women are in. And again, for me, it was babies
Mhm.
that had abnormalities, what we would call abnormalities. And it's a quality of life issue, which, as opposed to the dignity of every single human life, that every human life has value and what love is, which is to step into that and love and care for that person as opposed to end their life because it's hard. Again, you're not thinking about these things, but most people, at least who start into this, believe the narrative that, and it's been done so well by the abortion industry, we're here to help, we're here for the women. Well, they're not. You have to look behind the curtain of what's really going on. I find it so interesting looking back because, from OB-GYN training, we're always talking about saving two lives, trying to keep two lives as healthy as possible, the mom and the baby. And, it doesn't make logical sense. But I look back and go, yeah, we never talked about the baby in this situation, but every other one we're talking about the baby. And that's been very intentional from
Yeah.
the abortion industry too, is to make it look like the baby's nothing. And I think once we took ethics out of medicine, this idea that every life has dignity, inherent dignity and value, and that value is equal, and we fight for life, we don't offer death as a therapy. Once ethics came out and quality of life came in, I think it changed how we do medicine. And you're very vulnerable. It's like being a child in medical school and you're absorbing what your
Yeah.
parents are teaching you. It's like that. So, not an excuse on my part
Mhm.
at all. I fully take responsibility for what I did, but there is a blindness. There is a compassion. There's just twisted. It's not really looking at the whole situation. It's feeling bad for somebody and doing the wrong thing to help them as opposed to walking with them through it, if that makes sense.
Oh, it makes complete sense. And I think, I remember my first day of my third year's OBGYN 8-week clerkship being told you're in the most unique specialty because you're taking care of two patients simultaneously, a maternal and fetal patient.
Yeah.
Same thing was repeated the first day of my internship for my 4-year residency. And I immediately saw it in the hospitals and clinics in our decisions about what medications to prescribe, testing that we did on the baby. We would ask the mom, is the baby kicking?
Mhm.
So it was completely part of our work, except in this one element of induced abortion where the fetal patient became invisible
That's right.
and we justified it. And so, as you think about, you said we have to pull back the curtain. Tell us a little bit about. I have not performed an induced abortion. I have many, many times over the years had to prematurely separate my maternal and fetal patient. Probably the most common reason was, premature rupture of membranes. But my intention was to try to save them both.
That's
So that's not an induced abortion. An induced abortion, we know, is the intention is to not have a live birth. So it is the embryo or fetus's death is the intention of the intervention. Tell us about that curtain. How did it feel at the time? um, and a little bit about when that curtain got opened and when you decided professionally, I need to close that curtain. Talk to us a little bit about that.
Yeah. So, in our training, as you know, we do the woman's care, the labor and delivery, which is really an intensive situation, and surgery. And there are
Mm.
some things that we do that are incredibly hard. I know you know this, Susan, where you kind of just block stuff out and you do what's in front of you. A lot of urgent stuff, sometimes there are violent partners. I mean, the whole thing. And as I look back,
Yeah.
uh, I just see that I just totally shut everything off and just did what I thought I was supposed to be doing. And I was so brainwashed that I was somehow helping women in this. But, a lot of things come up because it's a lie. And it's not critical thinking. And so things are going to come up that are going to challenge that don't fit reality. So I remember even before I stopped doing abortions, situations would come up. And again, the abortions I did were for babies that had special needs. And so parents of kids with special needs would come in and would tell me about their life. And they would say it's hard, which was my take on it. It's like, must be hard. So I'm going to help them to not have a hard life. And they would say, actually, it's
Mhm.
beautiful. We can't imagine life without this person. This person has changed our family for the better. I'm like, that doesn't make sense. So, cognitive dissonance started to happen. But I'm going to say, thank God
Mhm.
early in my career, I had a situation in the middle of performing an abortion, which, yeah, I can't explain exactly what happened. It seemed like a normal day. Nothing unusual is happening, but I sat down to do the abortion, literally started, and it was like suddenly the curtains and the blinders fell off. Again, I can't tell you a situation happened, but it was like being in a horror movie. I suddenly had the realization
Mhm.
that here's a human being I'm about to kill. And there was this just
Mhm.
oppressive, dark heaviness in the room. And it was terrifying. I remember my heart racing and just sitting there going, oh my gosh, like this is a human being and I am about to kill this baby. What do I do? And I remember thinking, well, I've started. It's not like I can stop. And so I have to finish. And it was awful, like to know in the middle of this that you are actually killing a human being that you've never considered that baby before. And I just said, I'm
Mhm.
never going to do this again. This is evil. And I didn't. But, it's in addition to it being evil, it was also incredibly traumatizing, which is not the important part. But, that with trauma, you just shut it out. So I never did another one.
Mhm.
It took about 15 years later. Other events happened in my life. I know this is a secular show, but I ended up turning to God in the middle of that. And after a couple years, things related to abortion started to be put in front of me to start confronting the things that I thought about abortion just being a choice. And I think that's, it's
Yeah.
one thing to
Yeah.
stop. And then it's another thing to do what you hadn't done before and start critically thinking about what this is. And, I've learned a lot. Scott Klusendorf, I did the Colson Fellowship, which is a deep dive into worldview and understanding how we see the world and how that matters. And I've met quite a few other people who've done abortions, and it always comes down to two things, really. The consideration of the baby, like all of us had something happen where all of a sudden we saw the humanity of the baby that we had blocked out. And secondly, the fact that this is actually a killing. Like abortion is such a lovely word, isn't it? Like people do not understand the
Mhm.
meaning of that word. And for me, what happened
Yeah.
is somebody telling me about somebody they were very close to, a non medical person. And if you can imagine this, Susan, got invited to go see an abortion. And abortion is just a word.
Wow.
So if you can imagine a non medical person watching a baby be killed, and the person described to me this person's reaction, which I mean, you can imagine that's overwhelming if you saw somebody be murdered.
Mhm.
And I just said, how in the world could I have ever done that? And that just completely blew the blinders off for me. And it took me a while to start talking
Mhm.
about it, but I'll tell you, a move to Colorado was enough to get me talking. So, yeah.
Well, in this second part of our time together, we're going to be talking specifically about Colorado. So before we do that in this episode, uh, you bring up a good point that I think it's important our audience knows that APLOG is a secular medical organization. We're designed to educate and equip medical professionals to practice life affirming medicine. And we have members who have a strong faith, and we have members who would describe themselves as secular and not having that faith. So there's a commonality in recognizing that humanity that for some people their faith did that. For you, it sounds like um, it was something you're not sure of at that moment, because you said later is when your faith came into that place. But um, so as you think about after that day,
Hmm.
you had to, I would imagine, have conversations with pro-choice professionals like the mentor that you said that you had. Tell me, how was it received? Did you talk to other people to help you process what you were feeling, or did you how did pro-choice professionals receive you as you made that transition?
Yeah. So, at this time, so we're talking probably early, somewhere in the 90s, 1990s. And we hadn't gotten to the aggressive stance of our medical associations yet. That has come over time.
Mm.
And I was in Utah where there's a large, I'm going to say the Mormons and the Catholics are better about this than the evangelicals overall, not a blanket statement. But the Mormons at that time, at least, were very, very clear that this is not good. And so I was actually not in the majority doing abortions. I'll say that. And this is, I think, important for people to know how important it is to take a stand on this. The abortion before the last one that I did, I showed up to do the abortion, and the anesthesiologist didn't know that this was an abortion, that it was a live baby. And he's like, why didn't anybody tell me? I'm not going to do this. And he was, the narrative is if people won't do abortion, they don't like women or they're religious, right?
Mhm.
We know that humans have
Right.
value, whether it's religion or not. And here's a person who took a kind but very firm stand. He's like, I'm not going to participate.
Mhm.
So here I am going, oh my gosh, I've got to find, like, I didn't consider that a doctor would say no to this. I mean, this is the kind of important things that you do when you take a stand. And I knew and he doesn't hate women. I know that because I know him. And yeah, he's Mormon, but it seems to be more than that for him. So, all of this just gets you thinking because it's not logical to do abortions, right? And so it confronted something in
Mhm.
my head. I knew he was respectful and kind. He wasn't mean to me in how he did it. He just wasn't going to participate. And that made a difference for
Yeah.
me. And I said to myself, I was in Salt Lake, but it was a smaller community hospital in the city at the time. And I'm like, well, I don't want to bring conflict into my place. So I hadn't made the jump yet into this is actually immoral. But I didn't want to bring that conflict. So I had actually decided at that point to stop doing abortions because clearly it was causing a rift. And I didn't want to do that to my
Mm.
colleagues. I know that sounds illogical, but that was a step, right? And so I think, as
Mhm.
far as with your pro-choice colleagues who don't understand yet, taking those gentle, but no, I won't participate. I still care about you. There have been other people who've done abortions who actually had their colleagues ask them to come out for coffee and to talk to them about it, So I think you have to
Yeah.
gauge it by
Yeah.
conversation. But if they know that you care about them, you care about women, and this is an important stand, that makes a huge difference. I don't remember having any conversations with other professionals. And again, it wasn't pushed so aggressively by ACOG and AMA and other organizations yet. So I was still in a protected space. I would say for those of us who participate, you really need to know you're forgiven before you can start talking. And to me, that's why it was so important to me. I think that it was after I became a Christian that I was healed enough to be able to talk about it. Otherwise, you're just, you're just so broken by what you've done.
Yeah. I've heard it once said, your greatest grief can become your greatest gift.
That's
But it takes time to be able to do that. And so, as we close on this episode, I think you've brought up some really great points about, how to have dialogue with pro choice professionals. I loved how you used the term the anesthesiologist was kind but firm. And it reminded me that oftentimes when we're talking to people, um, we have to be good listeners. We have to ask them, tell me more, not use the word why, like, why would you do abortions, as opposed to tell me more about what makes you feel like that's important for your practice, so that we don't put people on defense. But is there any other advice that you would have for pro life medical professionals as we move forward? And really, we need dialogue. It's absent right now.
yeah.
And what are your final thoughts on this episode?
Yeah, thank you. So for me, a lot of it was learning to step into spaces where, again, the abortion industry and the media have done a great job of saying you don't have a voice, you can't say anything. And so they've done a great job of just
Hmm.
silencing everybody who is a dissenter to what the abortion industry wants. So I've learned to just educate myself, learn to become a better communicator. I've learned a lot from the Colson Fellowship about how to enter these conversations, as you said, Susan, that, you're not here to win a conversation. Most people who change their mind, it happens because of experiences they have that confront the lie. I mean, it's all about confronting the lie. Our brains cannot hold a truth and a lie together. So things have to come up that
Hmm.
confront that in some way or another. That's cognitive dissonance. And so I've learned a lot from somebody named Greg Koukl, Koukl, who wrote a book called Tactics, and I know he's updated that. And also from Scott Klusendorf about how to have these conversations, which is exactly what you say. It's, I care about this person. I care about the fact that babies are dying every day because people don't know what abortion is. And so I'm going to ask questions. I'm going to do the hard thing. It's going to feel really weird at first, but I'm going to enter these conversations. I'm going to listen to this other person, find out why they, find out their evidence. Like, what do you base that on? Tell me more about that. Especially if they're really angry, they often have an abortion story themselves. Learn about them. And
Right.
again, your goal is not to win a conversation, but to ask questions and get them to start thinking about that. Greg Koukl would call that putting pebbles in your shoe, and just things that kind of rub
Mhm.
wrong because the truth doesn't fit the narrative. So I would encourage people to get grounded in the two things that matter. We really are dealing with a human being who's been dehumanized, an innocent living human being from the time of fertilization. And abortion kills that innocent human being. Abortion is wrong because of that. Notice I didn't use religion in there. I mean, those are just the two facts that
Right.
matter, and be willing to have those conversations. Most people have not thought about it. They're just blurting out whatever they've heard from the media and the abortion industry. They're just repeating stuff. And so just ask me, what do you base that on? Is it okay if I suggest a different narrative? I think about that a little differently. Even just saying in a conversation, I actually think about that a little differently. I mean, if you said nothing else, they go, oh, there's a different narrative. So, I know you have to individualize
Mhm.
it, but I'd encourage people to do the work of really getting grounded in those two things, the humanization of the baby, what abortion is, and start entering those conversations. Practice, learn, do it again because it matters, because it matters.
Yeah. Well, Dr. Willer, thank you for your expertise. Thank you for giving us the gift of your story today. And I look forward to our next episode when we talk about the landscape in Colorado related to abortion. Take care.
Thank you.